A section of people with disabilities, PWDs, in Kabale municipality are at risk of dying from poverty-related diseases due to the living conditions they are staying in that are characterized by poor sanitation and accommodation. These PWDs who reside in Chikunjiri Handicapped Center, which is located in Southern Division, Kabale municipality, say that with the coming of COVID-19, their situation has worsened as the usual sympathizers who would extend a hand are in the lockdown. Chikunjiri Handicapped Center was built in early 1989 to act as a resource center for women and people with disabilities, mainly the youth, but it was later turned into a rehabilitation center for lepers and PWDs who were rescued from Bwama Island on Lake Bunyonyi, where they had been confined since 1994.
The government forgot that these people exist. Have always had people coming, they look at the building, they promise, they go. Even politicians have been coming here, but there's basically nothing that has been done. When you move around, the toilet facilities are really dilapidated. The bathrooms are very old. The drainage system is no longer that should keep people around. Generally, in fact, when you look, the persons with disabilities here are living in a very sorry state, with stagnant water around, with a leaking roof, water pouring inside as if it's outside. The working place, the workshop area is even now waterlogged.
Government tunajirire munonga abweka turataha hantu hatabonere icyo twenka turi kwetamwa kugira ngo no mu Uganda turimo ate chombe ko kikuzire echombe ko turarara mu kabarara heru itwe nkabarema okutwabereka amezi garatamu bw'amabati kukura nangwa n'ingigizi mweti zirimu nebirahuriti birimu mwenu embere yituraturira mu hano tinunji tawebonere.
When you get to this center, a rare odor hits you, a signal that the place is in poor sanitation standards. You will only see a few people seated at the doors to the various rooms, since others are either indoors battling their own challenges, while some are in communities begging for survival, which they say now begging has stopped because of the lockdown.
Ebintu bibi turakozese mikono tutwatura bitwara tuza kubiguza umu abine sente kuro kudown yajiremu yatukoma kandi yatukomera kimwe complete ahabwo kugira ngo eyitwa turaza kubikuza amaduka bakagakuza hati itwenka bareme bitwa turakora taburaho kuza kubikuza.
The place lacks essential utilities like water and electricity, which makes it hard for these occupants to find peace, given the fact that their roof leaks every time it rains, something they say has left them suffering from illnesses like malaria and hygiene-related illnesses for women.
There are those that could have come without us not realizing that they are caused by the poor hygiene, but we have people here falling sick. Like any other, sometimes you see some child is having diarrhea or a member is having diarrhea, and sometimes you suspect that it's because of the kind of hygiene around us. Malaria is already here. People are suffering from malaria all the time, and I believe it is because of the nature of the shutters. And much as we have the mosquito nets here and there, but we have a lot of malaria because of the mosquitoes freely entering and going out.
ngenu ka batwende terekato yetizibo ngenu batukune chombe ko ngenu barondera abo kuchundura tutura hantu abonera atenjura yago njura nerare tutero no kuraro mizi otine chizogore chipapora no kuraro mizi tutura tweswe chire papore njura yago.
If they could handle persons with disabilities, concerns of persons with disabilities, like they attend to any other vulnerable group, because I hear of disaster preparedness, I hear of the Prime Minister in Kasese giving out blankets, following up those who have had challenges with rain, with this, but we have not seen any attention being made to persons with disabilities needs. Especially this center here, honestly, has been in the media several times and over a number of years. So I wish the government could also consider us, consider this group as a vulnerable group like any other, and the Ministry of Gender could at least come up and see if they give us attention. We have this building renovated and provide for persons with disabilities like any other vulnerable group.
By the time we left their place late evening, they were already in total darkness. These are, however, disappointed with the leaders who only visit them during election campaigns.
Persons with disabilities have been here for over 26 years, and over those years we have had councillors representing persons with disabilities at all these levels. So we cannot say that these people have not going to present these issues there, but ever since these issues were presented right from 1995, by the way, in the Constituent Assembly elections up to today, there is no top leadership that has ever come here to show that they are interested in giving a hand.
But the district health officer promised to visit the area and assess how the health department can help.
But specifically for the people with disabilities in Chikunjiri, we know they are living in a house which belongs to the Ministry of Labour, and these houses are old. Actually, our teams were condemning them, that they shouldn't be inhabited. Secondly, they were compensated. I'm told they are not supposed to be in those houses because they are compensated. But we are going to tell our teams to ensure that they visit them, encourage them to be clean, as maybe we consult the Ministry of Labour and Social Development.
In Wundubujo district, the living conditions of people with disabilities are not far from those of Kabale district. These stress that a failure to access health services and social inclusion is their major challenge. Koda Jokas, the managing director, Rural Disabled Women, Rudiwa, argues that most of the health facilities in the district lack facilities that can take care of the disabled people.
In most cases, when you look at an expectant mother is coming to a health unit, reaching the reception maybe at the enrollment center, a person to interpret is not there. Now a person feels isolated, denied, marginalized, and therefore a person may end up withdrawing from getting to health centers. That's why the number reduces of expectant mothers going to health units.
The Rudiwa managing director says the situation has even been made worse by the government not considering the disabled, especially the deaf, in information dissemination in the COVID-19 era.
Remember, the parents are already in the gardens. This girl child is locked at home because you are talking of lockdown. Therefore, remember, this is a person, especially we are concentrating on the blind and the deaf. The blind person has not seen who has arrived, but is hearing words. Now, there is no person who is going to protect this person in a defense. Therefore, some of them have been raped, some of them have been defiled, and now this is the reason why we have registered an increase in teenage pregnancies, especially for children with disabilities. Because their security was really worsened by the lockdown.
Umar Muhanguzi, the Wundubujo Deputy Resident District Commissioner, who also doubles as the Deputy Head of the COVID-19 Task Force, says that as the task force, there are special programs they put in place to cater for people living with disabilities to enable them continue getting services. Asked on the interventions put in place for the deaf to get access to the messages concerning COVID-19 that are running on the radios, Umar admits that the issue has never been raised.
Because as ETF, I think it was an oversight. And I think as a leadership also, we are not, because it has not been raised in our meetings. So now that I have come to know about it, I'm going to inquire whether we have people with such challenges and how best we can manage
when it comes to the community development office, for them, they handle these people living with disabilities or formed up groups. Now, in a situation where those groups are not in existence, of course, we cannot. It becomes very difficult for the office to go on looking for one by one wherever they are. So when they come up in groups, it becomes very easy for us to address their needs. Now, it is my appeal. My voice can be, we encourage these people living with disabilities to team up.
Naomi Sababu lives in the hills of Karangura sub-county and works on her buttocks. She says every time she visits the hospital, she has to pay 4,000 shillings for someone to carry her from her home to Karangura Trading Center, which is at the bottom of the hill on which she stays, and then she pays another 10,000 shillings to Fort Portal.
Kakubani ngenda mwirwaru, nisaba transport nyingi, yoku nitwara nokungaruti. Hati nyo ndinye kizibu, chokwenda ningenda nikaraifu, nikuni tunga transport ya kutipeki, nja kakari. Hati akasente karika kwa zerechi.
Lohadhalema abakazi, nagakeramuna kutalidanizibwa, aboto mu byaro. Nagalengaho kwenda kubahamba, bitu ntulengaho ntukarati, ntubitahamu ka government nibiterekera.
Sababu says this money is too much for her, a person who makes a living from just weaving baskets, which have since lost market due to the COVID-19 lockdown. The Rural Disabled Association now says that government should put the needs of the disabled people at the forefront by putting in place only schools and health facilities that work on the issues of the disabled. At least a number of PWDs we have visited have tried to group themselves, mainly producing art crafts, to generate them some income, which they say has made them survive, buy little food, transport them, and even buy some soap. However, they say they need government interventions to give them materials to use, thereby boosting their income. According to data collected by the Uganda Bureau of Statistics, UBOS, persons with disabilities are often poorer than non-disabled people. The 2014 National Census estimates about 12.5% of Ugandans to have some disability. That figure is about 4.5 million today. The World Health Organization estimates that approximately 10% of any population is disabled. The United Nations Standard Rules on Equalization of Opportunities for PWDs 1991 urges all nations to show strong commitment on equalization of opportunities for PWDs. I'm Sarah Mobiru reporting.